So, proper PPEs are done and kept on throughout the procedure. Did you guys have heavy-duty gloves in here?
The hand washing gloves? No.
Hand wash. Oh, you have a regular gloves?
Yeah.
Okay. You guys are going to need to purchase like some those dishwashing gloves.
Those yellow ones.
Yeah, I mean, we don't really care what color they are, but the dishwashing gloves, we will need to purchase some of those. That may have just been something we forgot. So, excuse me, I am going to just. Does anybody have glasses? Who has glasses? Like patient? Do you have some?
Like goggles?
Yeah. Like goggles. Who
I
has your
do.
safety goggles? She has hers right there. So I would have came in, I would have washed my hands, which like I said, I'm going to go over that second. So after my hands are washed, what do you think I'm going to do? What am I going to put on first? Of course, you're going to have your lab jacket on. If you can see, my lab jacket is buttoned all the way up. So,
Gloves?
Goggles?
I'm going to put my glasses on first, my mask. And I'm not going to wear a mask throughout this procedure because I want you guys to be able to hear me. But you would put your mask on, then you would put your gloves on. Think about when you put your glasses on, and also when you put your gloves on, you kind of go around your mask, you kind of go around the back of your ear. So do you think you want to be touching, doing all of that, and then put, with your gloves, especially the gloves that you'll be wearing, because you'll be wearing your heavy-duty gloves. Those will be dirty. Those are called pretty much when you're doing dirty stuff. So I have my glasses. I'm just going to put these gloves on. Even when you're working with patients, you're going to put your glasses on, your mask, and then your gloves, because you don't want to be touching your hair and stuff like that with your gloves on. So once my gloves are on, I have my jacket on. So the dental unit and equipment are properly disinfected using the appropriate technique. So how do we disinfect? Can you look right there and tell me if there's some Lysol? Like, no, I'm talking about like right there at the sink, the next sink. Is there a can of Lysol?
No.
Okay. Any Lysol down there? Okay, let me grab Lysol. I don't think we have Lysol.
While she's looking for that, one of the things I will tell you is that, really pay attention to room setup, sterilization, and your PPE and infection control. If you look on your skill evaluations, each one of them has a section on that. If you don't pass that, you don't pass the skill evaluation. It should be the last one. And there's not much room. It's either acceptable or unacceptable. So it's one thing, if we do a skill evaluation and you should have PPE on, you either should have it on or you would tell me that that's something that you would do before you start the procedure. Like, before I did this, I would put gloves, mask on, and all this. If you come in and just show me and you don't, then you haven't followed procedure and you'll get an unacceptable on that and you will not pass the skill evaluation. That's how important it is.
Typically, there will be Lysol at each sink. So we take our Lysol. We have our 4x4 gauze. Pretty much, we don't touch anything in any other cabinet except this one right here. These will be your cubbies. This is where your stuff will go. Usually they're locked. I unlocked everything today. So there's a little basket and there's 4x4 gauze. And before we leave today, we'll kind of make sure everything is stocked. But you'll grab a couple pieces, maybe about 2 pieces of the 4x4 gauze. And what you're going to do, mind you, you're going to have a mask on. You're going to take your 4x4 gauze and you're going to hold it right here. And if you can, you're going to saturate this gauze. Can someone move my clipboard? Once my gauze is saturated, you're going to start disinfecting your unit. So your unit will be lowered. You're going to wipe your headrest, your chair. And this will be done when you first get here, at the beginning of, when you first get here, in between patients and after patients. So like at the end of the day, you'll do the same thing. Your hoses, you'll wipe this. You'll also wipe your hose. Same thing here. You'll wipe your hoses. Kind of wipe here. Important to remember that this is used when we're not here. They do oral surgery. They do all types of procedures. So you want to wipe it good because we can't necessarily ensure what the person before you did, how good they disinfected. You're going to wipe your light handles here. If you know you're taking x-rays, this is our x-ray cabinet. So you would wipe our tube head as well. You want to come over here. You'll want to wipe this table. Still, and these hoses over here, because this suction and things work. So you're going to want to wipe this. Wipe all of the counters down. Everything has been wiped down. Mm-hmm. Guess what? You're going to do it again. It's called the technique is a spray, wipe, spray. So you'll do it again. You go back over it. We're going to bleed our lines. And by that, can I have someone turn on one of the vacuums? Can you turn on one of the vacuums for me? It's important that we bleed. Yeah. It's important we bleed our lines that way because any bacteria or anything sitting in this water line is there. So after you wipe again, ideally, so now my vacuum is on, I have suction. You'll bleed the line. You'll take it and you'll just squirt water down into it. That's an easy way to do it. Ideally, you'll do that for about 30 seconds. Okay, that's done. I'll take my suction, put that back. Then, okay, so everything's been wiped down. Everything is in its drying stage. You'll wash your gloves with them on easily. Take them off. Mind you, I'm pretending these are my heavy duty gloves. You'll take them off. And once they're off, you'll take your Lysol and you'll spray them. You'll take them, fold them up, and you'll set them inside your cubby. That way. Everybody got that? Once they're off, you would wash your hands for 30 seconds. And then you would be able to start placing your barriers. So, the big bag that goes over our chair. We place that one over our chair. Then you have these little bags, like this. This little bag, I'm going to take it, put one over the air water. And like I said, down here is all of your supplies. You'll have a suction. You'll take a suction. You're going to place your here. I'm going to put a bag over this as well. So I think that next step said all. The next step, step number 4 said air water syringes, suction tips placed. So you would place an air water tip here. I don't have a cassette open with one, that's why I haven't placed it. My suction is placed. Headrest cover, barriers, and then you're going to place things on high touch items. So with this tape, one of these will go. When did I find out where it starts? So typically we place one here on the control panel, right here, because that's a high touch area. You're always going to be touching that to adjust your patient. You're going to place one on your light. When you're placing it on the light, you're going to take it off. It works easier if you fold down one side of it and place it here. That way it won't get stuck to each other. Same thing on the other side. Where else do you think is a high touch area? That one. And you'll know in your room if this side works. And this side has power as well. Just like we turned it on there. You look down, there's power there. So in this room, it works. So you'll place one here. Where else? If we know we're taking x-rays, you'll take it and you'll place one over there on that control panel behind Andrea. That control panel, I would just stick one right there on there if you know you're taking x-rays. Also, if you know you're taking x-rays, you're going to place one of these bags over the x-ray tube head as well.
The big bag?
Yep, one of the big bags, you'll place it over there too as well, if you know you are taking x-rays. Sometimes you'll see their handles here. Yep, and when you're wiping, you want to wipe down this chair. You want to wipe down these handles as well. You take and place it here, because that's a high touch area as well. Got that? Questions about anything so far? So after that, we saw our patient, well, after we've seen our patient, and mind you, you can do this all with clean hands, because everything is already disinfected. Clean hands will be fine to place all your barriers. So once we've done all of that stuff, we've seen our patient end of day. What we're going to do, we're going to get our heavy duty gloves back on, still your glasses and your mask. You are going to take off your bag. Honestly, for me, it works better if you use the bag as a trash can. I would take off these here. Take off all my barriers. Any trash you have on the tray, you would take and put it in there. So everything would go in the trash, and then you would wipe down the room again. Because we've seen our patient, we got to make it clean. Wipe down our room again. We're going to put our room in end of day position. Meaning, take it all the way up. Once it's all the way up, you know, with your light, sometimes you'll see people place the light here. We don't want to place the light here because this light gets very hot. If you've been to the dentist, you know that this light gets very, very hot. So don't place it here. You're going to set your light right here on this metal bracket table. Questions about that? All right, you can stop that one. Any questions? Pretty much looking